Hello, and welcome to the Coding Corner, Medical Coding Education. My name is Kristen Robinson. I am the founder, co-owner, and educator for the Coding Corner. And today we are talking about what is it to become a medical coder? What is it defined as? What do you need to prepare for to take the test? What are your options as far as study goes? What does the test entail? As well as what to look for the future. So let's go ahead and dive on into it. So first things first, let's talk about what is a medical coder. Coder is a person that takes information that comes from a medical professional. Typically, this is going to be a MD, DO, NPPA. This could also be a nursing home facility. This could be a rehab facility, a hospital, outpatient, surgical center. There are so many areas out there that coders can come into play. So basically what you do as a coder is you're taking that medical record documentation that provider has documented, and you are putting it into alphanumeric diagnosis codes. You're putting it into what we call CPT codes, which we're going to talk about a little bit more here in a minute, or HCPCS codes, which are also another form of codes that we use in the coding community. So like I said, this is a very important area. I have been in it personally for almost 11 years now, and I absolutely love this career. I started out as a coder almost 11 years ago now, and my primary specialty was in cardiology, but I have also worked for the payer. I've been there on those background denials where the provider is appealing things that have gotten denied. I have been an auditor. I've worked with vendor resource management, and I'm currently an education coding consultant where I help to edit and create education for coders and providers. So let's get into it a little bit further. Let's talk about some of what it entails to be a coder. When we talk about being a coder, you are basically acting as two and maybe sometimes even three parts. So this could be transcribing the medical record into those codes that we previously discussed. This could be examining the medical record documentation to make sure that it has all of the required information it needs. There are certain elements to every type of note that is required. We have evaluation and management service notes that have specific format. There are operative notes that have specific format, rehab notes, surgical notes. All of these things have specific requirements, most of which have to do with the patient's information and the provider's information. What's the patient's name, date of birth, medical record number, the date of service that the provider is seeing them, what the provider saw them for that day, and then the provider needs to sign and date that note. Now, there are great details that come with that, much further than what we're going to cover in today's video, but that's just a broad spectrum of what we're looking at. You can get even deeper into the coding world as becoming an auditor, or getting into the payer side of things, or being into fraud investigations, or what I'm currently doing, where you can become an educator for coders or providers, or both. So the main things that we really have to keep in mind is that some people want to get into coding because they want to make a bunch of money. They want to work from home. They want to have flexible hours. They want to be a stay-at-home mother and still have a income coming into the household. Now, some of these are very likely, some of these not so much, depending on the employer that you get once you become certified. Let's start off with what program do you want to choose to get your certification? So there are two major certification bodies, we'll call them, that you can choose from. So typically there are two certifications that almost every position in the coding world will request. One of them is from the AAPC, the American Academy of Professional Coders, and then there is AHEMA, which is a different program that we are not covering in today's video. So for the purposes of today's video, we are talking about the AAPC program. So this is the area that I have my entire background in. I have multiple certifications. I am also a AAPC approved instructor, a subject matter expert, and I'm on the advisory committee for the AAPC. So today we're really going to hone in to the CPC. This is pretty much what you would want to call the gold standard of certifications. Unless you are going into health information management or specifically inpatient facility. But when it comes to professional fee coding, which is what we're going to be discussing today, you want to look at AAPC. So, like I said, the gold standard for professional fee coding is the CPC. That is becoming a certified professional coder. Okay. So, when we talk about becoming a CPC, this is your standard coding certification. You're going to either do this by an instructor-led program, a self-paced program, or on your own. Now, there is a difference between the three. We are going to get into them a little bit further today, but let's really focus in on what are some of your other options if you don't want to immediately get your CPC. Let's say you want to become a biller. They also have a certification called the CPB, which is a certified professional biller. So this is a person that isn't necessarily coding. This could be the person that's inputting the claims. This is the person that is taking payments or making sure that the payments are posted into the account in which they work for the company they work for. So that's another option if you don't necessarily want to be a coder. Now, the next two options, you can both take these, or any certification you can take straight out of the gate. Now, some of the more specialty certifications, like some of the ones I have, the CEMC, which is for the evaluation of management services, or say the CCC, which is for cardiology, they really want you to have 2 years of experience in that particular area before you pursue the certification. The CPC, you do not have to have experience to go for that one immediately. The CPB is the same way. Another one is the CRC. This is your Certified Risk Adjustment Coder, and this has become very big over the last few years because Medicare risk adjustment has become so large. It's become large in the payer side of things, so your insurance companies, but there are also hospitals that do what we call CDI, or clinical documentation improvement, where they are looking at value-based and they're looking at HCC codes, which we are not going to go into depth on today, but that is another option that you can go into without having to have that background experience. Now, the last one I just want to mention on today's presentation is the CPMA, which is a Certified Professional Medical Auditor. It would be preferred that you have your CPC, but there are no standards that say you have to have your CPC before becoming a CPMA. It does make it easier because once you've become a coder, it makes it easier to be an auditor as well. Okay, so like I said, you have options out there. The main thing to keep in mind is what area of this field do you want to pursue? If you want to be a coder, if you want to be an auditor, if you want to be a biller, if you want to be risk adjustment, all of these things you have to consider before you begin pursuing the certification itself. So now let's talk a little bit more about what the program that you choose should include. Remember, I mentioned you have the option of going through an instructor-led program, a self-paced program, or on your own, which is basically not a program. It's basically you finding resources out there that are usually minimal to no cost. Usually takes you a little bit longer because you don't have that structure that you do with an instructor-led or a self-paced program. So, what at the bare minimum should that program include? Okay, so anatomy and physiology is very important. You have to know the body systems. You have to know the anatomy. You need to know where everything is located in the body, what these providers are doing to the body, and why it matters. There are questions on the test specifically for the body systems and the anatomy. So my suggestion is that if your program does not have a fundamentals of medicine or an anatomy and physiology class that is included, you need to make sure that you are finding something in that area to take as a prerequisite to the certification itself. It is imperative that you have that information. Another area that is very important is compliance. So when we talk about compliance, we're talking about meeting the standards of the federal programs, laws, and guidelines out there. Most importantly, to start off would be HIPAA, which we're not getting into again today. This is all just background information, but there are specific laws that are out there, more of which you can find out about online, but the program needs to encompass these things because they will be on the test. Plus, you have to know them for real life as well, because there are certain standards that your employer is going to expect that you follow to ensure that not only you don't get in trouble, but more specifically, they don't get in trouble if you aren't following those compliance guidelines. So, the three main areas on the certification test, specifically the CPC, is going to be your questions on the CPT book, which is the current procedural terminology book. This is put out by the AMA, or the American Medical Association. Then we have our ICD-10 CM book, which is the internal classification of diseases, and this is the 10th edition. Now, when I started, we were still on ICD-9, which was the edition that came out before this, and there are some countries that are already on ICD-11. That is in our future here in the United States, but we're not quite there yet. So CPT is what we would call your procedure codes. These are anywhere from your 10,000 series all the way to your 90,000 series codes. Again, we are not going in depth on that today. The ICD-10 codes are your diagnosis codes. This is what's wrong with the patient, the condition, the issue, or the problem. Then you have your HCPCS codes, which is your Healthcare Common Procedure Coding System codes. These are alphanumeric, so you have a letter followed by numbers that make up that code, and it could be medications, it could be supplies, and some Medicare specific programs. So that's just a brief overview at the very tip of the iceberg as far as what you need for the certification. So a little bit more about medical coding in and of itself. So you are using these three major code sets, CPT, ICD-10, and HCPCS, to use in your everyday career. This is how you're going to take that provider's medical record documentation and you're going to turn it in to a claim that gets billed to the insurance company to get paid for that patient, whether it be a office visit or a surgery or some other type of medical visit. So the two main ways to get this certification is instructor-led or self-paced. So the AAPC directly does have their own program. They actually have 3 forms, which is basically the live instructor, which means that you have someone that you meet with so many times a week and they are teaching you live. Self-paced means that they provide you all the same course materials and all the instruction is on demand, meaning you can watch it whenever it's convenient for you. They also have a third option, which is the Job Ready program, and you can definitely go over onto the AAPC website to learn more about that. But that's basically like the top tier program. That includes additional help that is not included in the other 2 programs. Now, some of the other options you have, of course, is to do it on your own. So you're not purchasing an official pre-created program. In this case, what you're doing is you may be going on YouTube and finding people such as myself who have programs out there to assist coders and to assist people who are studying to become a coder. So we are out there to provide additional assistance, whether it be about different sections. Like I just finished a series for ICD-10 guidelines, and it goes through all 22 chapters of the ICD-10 guidelines. And then there are other people that go through different other areas. I cover all of my specialty areas, and you can definitely go check that out on the YouTube channel that you're currently watching this video from, which is the Coding Corner Medical Coding Education. Now, we offer a specialized coding and tutoring and coaching program. So what this is a one-on-one tailored program where you book your own sessions at your own rate, how often you want them to be booked. It is a live coaching session where we create the education based on the student or coder's needs. So if you're currently going through the program and you just need additional help, you can reach out to us. Already a certified coder and you are going into a new specialty, or you need more help on getting better at your job, quicker at your job, more efficient at your job, you can book with us and we can go through that with you. We can go through live examples. We can create quizzes based on your specific needs. That's another option, especially if you're doing self-paced programs or if you are doing it completely on your own. One of the greatest programs that you can buy on your own is the Bucks step-by-step program. I am not sponsored by them, but the publisher is Elsevier Publishing. It has been around for years and years, and it is a great on your own program to consider doing yourself. So let's look into how long should it take you to study to become a coder. So these instructor-led and self-paced programs that are structured, they have a syllabus, a curriculum, and they have all the courses pre-created for you or presented live to you. Usually are between 3 to 6 months of that program, and then it's on you to prepare for the exam itself. The self-taught program, meaning you're not on a specific program that you've paid for, you're doing it on your own, usually takes a little longer. It may take 6 to 12 months. It may take longer than that, depending on if you have a history in a clinical background or if you're brand new to the medical world completely. It may take you longer than 12 months. And that's just being completely transparent because everyone learns at a different pace. The main takeaway here is that you have to focus your time and energy directly on learning this. This is not something that you can pick up and put down and expect to excel at it, especially in a short period of time. This needs to be something that you focus on, just like if you were teaching your children You need to be spending 1 to 2 hours a weeknight on it, or as many weeknights as possible. If you have your weekends available, you definitely need to be putting a work day in, 6 to 8 hours preferably. And the more you do this, the better you're going to get, the quicker you're going to learn it, and potentially the faster you're going to be certified and you're going to get a career in this field. Trust me on this. It's all in. Time in equals time out. So the more time you put into it now, the more you're going to get out of it later. Okay, so now let's talk about the test overview itself. Okay, so you have 100 multiple choice questions where you need to learn process of elimination and time management skills. These are the two essential things that you need to pass this test, other than learning the material itself. So the essentials of process of elimination is all about looking at the answers and eliminating 1 to 2 that don't make sense, aren't in the correct order, or aren't out of the correct part of the book for the question being asked. So you should be able to look at A, B, C, and D and potentially eliminate 1 to 2 answers immediately so you can focus your attention on the other. Is it because the CPT codes are not in the correct order? Is it because the ICD-10 codes are not correct? Is it the modifier that's being chosen? These are all things you're going to learn in the program that's going to help you choose the answer quicker. And that brings us to time management. 100 questions, and this is a 4-hour timed test. So what that means is you have 2 minutes per question. So my advice, and usually most people's advice in this career that educate on this, are going to tell you to answer the questions that are easier for you first, followed by going back and answering the questions that are going to take you more time to answer. So just remember, time management and process of elimination are going to be your heavy hitters when it comes to passing this test. Now, you have all multiple choice, but it's broken down by section. You will finish the test out in case questions. These are usually the hardest for most people because you're going to read a blurb about a evaluation and management service or a surgical service or whatever the case may be, and then they're going to ask you questions about it. My suggestion is you look at the questions first before you read the case. That way you know exactly what you're looking for, because sometimes these cases are 2 or 3 or 4 paragraphs long, and you don't want to waste your time reading 4 paragraphs of information when you only need 1 sentence out of all 4 paragraphs to answer the question being asked. So really make sure you're paying attention to what you need to look for in those cases to use your tools for time management. Okay, so let's pop over here and let's take a look at the AAPC page, and then we'll come back and finish talking. Okay, so if you would like to go and find out more about the certification and what is entailed as far as getting training and taking the exam, as well as what's on the exam, let's go ahead and walk through that. So you will go to aapc.com and it will take you to the main page, certifications, view all certifications. And if you scroll down, you can see the different certifications that you can choose from. For the purposes of today's presentation, we are going to be looking at the CPC. So you have the option to look at scheduling the exam, prepping for the exam, the training packages that they offer. It goes over the exam format, the ways to take the exam, the time allowed for the exam, the equipment required. Now, this is specific to if you're going to take this at home. If you are going to take this at an in-person site, you will not need any specific equipment once you get your job. It'll go over the ways to maintain your certification, which is by CEUs or continuing education units. For one certification, it is 36 units per year, and it goes up with every additional certification you get. You also have the pricing, which is for one attempt of the exam and 2 attempts. I always recommend that people choose the 2 attempt option simply because if you do happen to fail the first time, you have already paid for that second option. Let's get into what we're going to be looking at for today's purposes. If you are going to be taking the exam, you need to know what is on that exam. So it talks you through what to expect the day of, if you're taking it at home, if you're taking it at a testing center, what you need to pass the exam, your books. If there is a calculator built into the test, you are not allowed to bring one with you. It tells you what you can put in your books. But the most important thing that we want to cover today is the breakdown of the exam itself. So you have 4 questions on medical terminology, which is about the human body, 4 questions on the anatomy of the human body, 3 questions on compliance and regulatory. This is covering your fraud and abuse, NCCI edits, NCDs, LCDs, HIPAA, ABNs, and RVUs. The official coding guidelines to include the parenthetical notes and modifier use. There are 5 questions on ICD-10, which are your diagnosis codes. 3 questions on HCPCS codes. This includes supplies, medications, and there are specific services specifically for Medicare patients that are covered on the test. Then you have your CPT questions. So I'm not going to get into this too deeply for the purposes of today's presentation, but there are 6 questions in the 10,000 series, and then there are 6 questions in every series after that, 20, 30, 40, 50, 60. 1000 series, as well as the radiology series, the pathology and laboratory section, medicine section, the evaluation and management section, and then you have 4 questions on anesthesia, and then there are 10 cases with questions coordinating to those particular cases. So now that we've looked at the AAPC website and we see the breakdown of these questions, now let's talk about preparing for the exam itself. So when you are studying for the test, not just going through the program itself, but when you are preparing to take the exam, I suggest that you use format like flashcards. You need to be writing your terms out. It is proven that when you handwrite things, you remember them much better than you do when you are typing them out or only just reading them. Now, that being said, everybody learns differently. You may be one of those people where you don't need to write it. You just need to physically see it, or you need to see someone giving you instruction on it. And that's fine too. But flashcards, writing your terms, tabbing your books is also very important. There are YouTube videos out there on how to tab your books, how to make notes in your books, color coding your books, highlighting, all the things. But just remember that just because it works for one person doesn't mean it's going to necessarily work for you. You really need to understand why this is being highlighted or why this page is being tabbed. So once you understand how to maneuver through the books, it'll make it easier for you to tab and mark up particularly. Like if you want to use yellow for certain codes and pink and green and orange for different things, do what makes sense to you. Now, like I said, putting notes in your books, I think are a great thing. I've used notes in my books for every single exam I've taken, and it's been very helpful for me. Some people think it's overcrowded and they don't want to do that. That's fine too. It's completely up to you. Now, I also recommend no matter what program you choose, if you choose to go directly through AAPC, they offer the practice tests as part of the program. But if you are not choosing to go through AAPC, whether you choose to come over here and take a program through the Coding Corner or the coaching program through the Coding Corner, that's fine too. But you still need to purchase 2 things from the AAPC site no matter what. Now, some programs also include these too. You just need to look at the program in which you are personally getting ready to sign up for or may already be in. So you need the study guide directly from the AAPC website, and you need the practice exams directly from the AAPC website. These are the things that come directly from the AAPC and are guaranteed to be some structure on the exam itself. Okay. Some people even say that they think the practice tests are actually harder than the test itself. A lot of the test questions come directly from those practice tests. They may not be the same, but they're going to be similar based on the material. Another option that you have, take a boot camp. There are local chapters, AAPC chapters that offer boot camps, some of them for free, some of them for low cost. There are other programs out there that offer boot camps. Doing a boot camp at some point, we just don't have one yet. So those are options that give you usually a 4 to 6 hour window of time where you are taking a 1-day class. Now, you can do that on your own without having to take another program, but you really want to wait and do the boot camp towards the end, right before you're getting ready to take the exam, because you already know the material. Now you're just putting everything together. So the next thing we want to talk about is the coaching and tutoring. The Coding Corner offers live one-on-one coaching with sessions tailored to you as the student. Everything we do is 100% based on what you need as a student or as a coder. Our program is pay as you go. That means if you want to sign up for 3 sessions, sign up for 3 sessions. You want to sign up for 1 session a month, every other week, whatever works for you, or you just need to come see us once because you have some questions before the exam, that's fine too. We also offer messaging options, we offer lessons, and we can give you live feedback, which is something that I have seen time and time again is something that might be missing from other programs. So we already talked about test day a little bit, 100 questions, 2 minutes per question. This is a 4-hour time test, and you have 2 ways to take this. You can take it online as a timed proctored test where someone is on the other side of the computer watching you take your test, and there are specific guidelines on things that you have to have for your computer. You have to have a camera. Everything you need to know is on the AAPC website to get set up for that. Now, my personal preference, and the last 3 exams I've taken, I take at a testing facility site. So this is a testing facility site that has partnered with AAPC that provides a quiet area with a computer and a small desk space for you to take your exam. You don't have to worry about internet issues or a webcam or a specific computer setup or any of that kind of stuff. That testing facility site is set up exactly the way AAPC wants it to be set up. Okay. So those are your 2 options on taking the exam itself. Now, results. Now that everything is online, most people get their results in just a couple days, but they still say to allow up to 7 to 10 business days. So, like I said, usually these days you get it really quick, especially if you take your test on a weekday early in the day. The passing score for this test is 70%, which means anything 69% or below is a failing score. And there are times that people fail this on the first time. That's why I recommended early in the video that you go ahead and you purchase those 2 attempts versus just purchasing 1 attempt. Now, you do get a formal printed certificate in the mail after you pass the test. If you have no experience whatsoever in the medical field, you've never worked with codes or coding, then you will start off as a CPC-A, which is an apprentice status where you need either 1 year of education and 1 year of on-the-job training, or you need 2 years of on-the-job training in order to remove that apprentice status. Now, if you do already work in the coding field or in a position that works with codes, then you can request that your employer write a letter that you can submit to the AAPC before you even take your test. And when you pass your test, you will immediately be a regular CPC with no apprentice status. And that's going to give you the best shot at getting a job quickly. Now, your certificate will be mailed within 4 to 6 weeks. If for some reason you don't get it within that time frame, you can always reach out to AAPC. So you also want to look at getting practical experience. So AAPC offers Practicode. That's a great option. If you want that hands-on knowledge, it also gives you that 1 year of education that you can add with the 1 year job experience to get that A removed. Now, that is an additional benefit, or it is included in, I believe, the largest package that you purchase from AAPC. Now, that is exclusive to AAPC. Okay, so that's going to close out today's video. I hope you really enjoyed this video. If you are not already subscribed, please make sure that you hit that bell to be notified when we go live in the future. We look forward to seeing you in the next video. Feel free to email us directly. I will drop all of the social media platforms and our email in the description of this video, so you can reach out to us directly if you have questions or if you have suggestions on other videos that you would like to see in the future. And I look forward to seeing you again next time. Have a great day.